All right. Good morning, everybody. This is Dr. Ahmed Mohiuddin, consultant physician and diabetologist practicing at Zoe Hospital, Sattapur. So I've been practicing for more than 10 years and I come across a lot of patients with GERDs, APDs, reflex esophagitis, or many common symptoms with regurgitation. So I would be happy to share the scientific session about the lifestyle changes for Barrett's esophagus today. So you need to understand what Barrett's esophagus is. It's a condition commonly seen in patients who suffer from long-term acid reflux or a condition known as gastroesophageal reflux disease. What happens is the appearance of tissues of the inner walls of the food pipe called the esophagus gets damaged because of the long-term exposure to the acid levels. Although there is no physical symptoms of Barrett's esophagus, people who gets affected by this usually have the symptoms of heartburn, difficulty in swallowing, recurrent coughs, atypical chest pain, nausea feeling, and then they also feel that the acid is bringing up in the throat. So these are all the common symptoms which you come across. And then the medical treatment for this condition mainly focuses on treating the acidity through the usage of medicines and also the medicines which reduces the production of acid. The other option is through the removal of damaged section of esophagus through surgery. So beside these, there are various lifestyle changes that a person can do when they get affected with this condition to make symptom free or to control the disease. Dietary changes includes you should not have items that increases the acid levels in the stomach. That might be is food rich in spices, food rich in oil, and all those things to be avoided. Other changes, if you are committed or if you are taking excessive alcohol or smoking or wearing a loose fitting clothes, you need to cut down on alcohol and smoking. There are various other exercises to help or relieve the symptoms of GERD. One of them is the Shaker's exercise, which can help or improve your ability to swallow. So it consists of a couple of exercises which are performed while lying down. The first exercise would include person lying on their back and must lift their head and try to look towards their toes and hold that position for 1 minute. And this exercise can be repeated for 3 times. The other exercise is involves lifting one's head and then resting it down 30 times. So the proper lifestyle changes and diet changes will reduce the chances of Barrett's esophagus getting worse and progressing to cancer. So see, this is the whatever I have shared is the scientific data. It comes from a n number of clinical patients who have come across with the similar complaints. And with the usage of this molecule, omeprazole, and with the lifestyle modification in terms of exercises and diet restrictions, specifically patients with high oil, high spice diet and oily food, it helps in relieving the symptoms. So the data comes with n number of scientific evidences and the studies. So the clinical experience would be similar to the data which I have shared. Thank you.